Do you ever feel that your body is trying to tell you something is wrong, but you just can't pinpoint what? There are various mysterious symptoms that can surface over time that signify health issues brewing under the surface. Oftentimes, they manifest as minor problems you learn to live with, like trouble sleeping, fluid retention, or frequent bathroom trips. However, these vague symptoms that disrupt your day-to-day quality of life can actually be your kidneys sending you a cry for help. Your kidneys act like a complex filtration system that removes waste and excess fluid from the bloodstream. When kidney damage develops slowly over many years, you may only notice subtle symptoms at first. But if the kidneys continue deteriorating untreated, it can lead to the irreversible condition of kidney failure. At this point, the only options are dialysis or a kidney transplant. That's why it's so important to tune into the quiet signals your body is giving that signify kidney damage early on. Stay tuned as we reveal 12 sneaky ways your kidneys show they are in danger before it's too late. Catching these changes early gives you the best shot at supporting your kidney health and preventing long-term complications down the road. Persistent puffiness around the eyes, face, and feet. Have you noticed any unexplained swelling or puffiness around your eyes, ankles, or face that doesn't seem to go away? This is often one of the very first and most subtle signs that your kidneys are struggling to work at full capacity. Healthy kidneys constantly regulate the body's delicate fluid balance by filtering excess water and sodium from the bloodstream. Kidneys damaged by disease have a progressively harder time performing this function efficiently. When the kidneys cannot adequately eliminate extra fluid, it builds up in all areas of the body in the form of edema or swelling. Pay very close attention to any abnormal fluid, retention, or swelling that you can't explain, as it usually indicates compromised filtration ability of the kidneys. Catching it early allows steps to be taken to improve kidney function before permanent damage sets in. Increased fatigue, weakness, and anemia. Feeling an excessive lack of energy where even basic daily tasks wipe you out? Does it seem like you can never get high-quality sleep no matter how early you turn in? These are classic signals that your kidney function may be dipping. Healthy kidneys produce a hormone called erythropoietin that enables the body to form enough red blood cells carrying oxygen throughout the body to energize you. The lack of healthy red blood cells from poor kidney function causes the fatigue, pronounced weakness, and shortness of breath when exerting yourself. Listen to your body and investigate ongoing exhaustion with your doctor to pinpoint if your kidneys need support. Catching chronic kidney disease early provides more time to slow the progression. Itchy skin, dryness, rashes, and discoloration. Itchiness and skin irritations can begin to surface when waste buildup in the bloodstream aggravates the skin. The kidneys act as filtration machines that continuously remove urea, uric acid, and other toxins from the blood that would otherwise accumulate and cause harm if left to circulate freely. With kidney impairment, the skin is directly affected because these irritating waste products are not being removed efficiently. Some signs are random rashes, severe dryness, flaky skin, discoloration, and unexplained itchiness all over or in specific spots. Bring up any abnormal skin changes to your physician to uncover if kidney dysfunction could be brewing underneath. Metallic or ammonia. Taste in mouth and bad breath. An ammonia-like taste in the mouth or strange breath odor is a peculiar but telltale clue that your kidneys are not adequately filtering urea waste. Under normal conditions, urea is removed from the bloodstream as it passes through the kidneys, then safely expelled from the body through urine. But when the kidneys are impaired, urea builds up and gets exhaled through the lungs or saliva, creating a bothersome metallic taste or fishy odor. The metallic mouth sensation is most apparent in the mornings upon waking when urea waste accumulates overnight. Bad breath or ammonia taste from poor urea. Excretion signals damaged kidney filtration. Lower back and side, pain or discomfort. Chronic dull pain or tenderness around the lower back and sides can develop from kidneys inflamed and enlarged from chronic disease. Kidneys riddled with scar tissue and cysts from prolonged damage become swollen, and this causes discomfort and pressure in the back and flanks. In women, this backache may even feel similar to period cramps. However, persistent pain on one or both sides of the back along with the flanks warrants an urgent kidney evaluation. Be sure to get any lasting soreness or pain between the bottom ribs and hips checked out. Catching the cause early is key to preventing permanent deterioration and kidney failure that necessitates dialysis or transplant. High blood pressure or hypertension. There is a very strong correlation between high blood pressure and declining kidney function. Unmanaged hypertension severely damages the tiny blood vessels within the kidneys over time, causing chronic injury. On the flip side, kidneys already disrupted by illness cannot properly regulate fluid balance and electrolytes, leading to a rise in blood pressure. That's why it's critical to closely monitor your blood pressure levels, as high readings signify additional strain on the kidneys and increased risk for further harm. Working on lowering your blood pressure can make a big difference in preserving kidney function down the road. This may include medication, diet changes, weight loss, exercise, and other lifestyle adjustments. Listen to what your body is telling you. Recurrent urinary tract infections. Suffering from frequent bouts of urinary tract infections, such as kidney infections and bladder infections, can be another red flag for potential kidney problems brewing. UTIs develop when bacteria abnormally enters through the urinary tract and begins attacking the bladder wall and kidneys. Kidneys already weakened by pre-existing chronic disease are at greater risk of these repeat infections. Some common UTIs include pyelonephritis, which affects the kidneys, and cystitis, which affects the bladder. Indicators include burning urination, pelvic pain, and urgency. Seek prompt treatment for recurrent UTIs and have your physician screen your kidney function through blood and urine tests. It's beneficial to get ahead of any kidney disease while in early stages. Persistent nausea, vomiting, and poor appetite. Chronic sleep disruptions like insomnia, constantly broken sleep, and restless legs syndrome can be signs of kidney disease impacting hormonal balance in the body. Healthy kidneys release hormones that regulate sleep and mood. Diseased kidneys upset this cycle, leading to sleeplessness and restless feelings in the legs that also prevent quality rest. Furthermore, kidney problems allow toxins to accumulate that can exacerbate feelings of restlessness. Trouble achieving deep restorative sleep for extended periods should not be brushed off. Talk to your doctor about a kidney health evaluation, as managing sleep symptoms and their root cause early on gives you the best outcome.